The acoustic lens. The acoustic lens is a membrane cap displayed here as a large gray region. The lens is a cap that covers the elements. The lens acts as a mechanical separation for electrical isolation and cleaning the surface. The lens provides further focusing in the elevation plane. A common term for the surface of the lens is the footprint. Lens width and thickness. The thickness of the element or elements within the transducer determines the thickness of the ultrasound beam, and the acoustic lens helps to focus the beam. The width of the lens is the azimuth, demonstrated by these teal arrows. The azimuth determines the width of the beam and lateral resolution plane. The orange arrows stretch across the elevation. The lens has a focusing effect in the elevational direction. The elevation affects the slice thickness of the beam. As seen in the diagram, this lens is an external component. In some transducers, the designs also include lenses within the transducer. The strain relief is made of lightweight material, making holding the transducer and cable more ergonomic. The strain relief is a common location for damage. If the cable accidentally wraps around an external component on or near the ultrasound system and the system moves with some force, the strain will uncouple from the transducer housing. The external cable material is lightweight and supple. Within the cable, there is power to the transducer and sophisticated wiring between the elements and the ultrasound system. Wireless transducers that do not have cables are available. There are two types of connector ports, pinless type and pin types. Pinless connector ports mate the transducers to the system without pins. Advancements in pinless coupling reduce damage from transducer installation and reduces image artifact. In the pin-type connectors, damage can occur to the pod where the transducer interfaces with the ultrasound system. With pin-type connectors, take care to properly align the delicate connector pins to the system interface before locking the transducer in place. Create a good habit and always secure cables to the hooks and holders after every use. The storage shelf below the transducer connecting system can serve as temporary storage for the transducer connectors when not locked into the system. Avoid leaving cables on the floor. The floor is unsanitary. Additionally, when cables are unattended, cable damage is likely. The wheels on the ultrasound device can roll over and pull the cables. Damage will occur to the connections and wiring inside. Secure transducers and holders along either side of the ultrasound unit to prevent unintentional damage. To ensure that there is no air trapped at the lens surface, coupling gel or ultrasound gel is added between the transducer lens and the skin surface. So, what happens when the air is between the skin surface and the lens? The white arrows shown here are next to the equidistant lines. These lines are created by a pocket of air that is trapped at the surface of the transducer's lens. These equidistant lines are a false signal. It is a reverberation artifact. This artifact is caused by air trapped at the lens. Air is a strong reflector to sound energy and causes the sound to reverberate or bounce back and forth. The remaining surfaces to the left side of the image have good acoustic coupling, no trapped air, and the energy transmits into the body. Pro tip on acoustic coupling. Ultrasound gel comes in many viscosities. Preference and availability vary between regions and laboratories. Thinner viscosities applied to the skin are helpful for ultrasound exams that cover larger surfaces, such as the abdomen. Denser viscosities are useful for applying directly to the transducer over the smaller surface, as in cardiac examinations. Ultrasound gel is available in single and multi-use packaging. Single gel packets are handy, but take care not to scrape the packet across the lens membrane. Scrapes to the lens will damage the transducer, possibly cause cross-contamination issues, and can affect image quality. Using multi-use bottles of non-sterile ultrasound gel have been implicated in outbreaks of nosocomial infection. Recent guidelines noted that non-sterile gel bottles should be discarded after 28 days from the original opening. However, you should follow your department guideline for non-sterile gel bottles. Transducer cleaning. Follow your department guideline on transducer disinfection before and after examinations. Refer to your ultrasound systems manual and transducer care guidelines for a list of approved cleaning chemicals and disinfecting guidelines.